I worked closely with Cindy Sage on the public health implications of electromagnetic fields, both the power line frequency fields and the radio frequency fields from cell phone communications and other communication devices. And I think our goal was to try to put it all together, to take the scientific studies that had been done, both the animal studies and the human studies, and to try to say what the implications were for human health and to identify what steps needed to be taken to try to protect people from exposure and therefore from disease. I am a public health physician. I have many years of study of the brain, which is only one of the organ systems affected here. My first involvement in the whole field of electromagnetic fields began 26 years ago when I came to New York from Washington, D.C., and was given the responsibility of administering a program to determine whether there were health hazards from high voltage power lines electromagnetic fields. And that was a research project that ran for 5 years and ended in 1987. During that time, I was simply the administrator of this program, where we had experts in different fields, but we funded 16 different research projects, including one very important one, which was the study in Denver, Colorado, that replicated the observations from the 1979 study of Wertheimer and Leeper, showing that children that lived in homes with elevated magnetic fields were more likely to develop leukemia. And once you get in this area, you can never escape. And I have been involved in the whole issue of electromagnetic fields ever since. After our report was published in 1987, I became the official spokesperson for New York State on that issue. I've never done personal research on EMFs. I've edited a 2-volume book on the subject and been part of many national and international committees. At the moment, I'm primarily involved in studies of PCBs, polychlorinated biphenyls, dioxins, and chlorinated pesticides like DDT. I've in the past done a lot with the metals, lead, methylmercury. I'm now involved in some studies on depleted uranium. We actually have a facility practically in my backyard that manufactured depleted uranium warhead tips, burned all the waste in an incinerator that had no emission controls, and the evidence appears to be that 10 ton of depleted uranium was burned and the ash fell over the city of Albany. This is the same amount that has been used in both Gulf Wars, and the emissions are in a very concentrated area. And yet nobody has done a health study. So I've been involved in a number of things. I'm increasingly interested in chronic human disease in relation to exposure to environmental contaminants, especially things like cardiovascular disease and diabetes, diseases that most people are oblivious to the fact that there's strong contributions from environmental exposures. We concluded that there are significant human health adverse effects from exposure to both power line frequency fields and radio frequency fields. Now, this is a conclusion I drew 20 years ago for power line fields. The evidence in the meantime has gotten stronger, but the evidence that power line fields cause leukemia in children, in my judgment, is very, very strong. And yet there has been little effort to reduce exposure, to set standards that are realistic. Now, the situation with radio frequency fields is a little less well studied. And this, of course, is very, very important because we have this profusion of new uses of radio frequency communication frequencies. And every kid has a cell phone, and they're spending hours on cell phones. And the evidence in those studies, in my judgment, is perhaps not as strong as for the power line fields, but the implications are even more serious. They're so serious because we do have suggestive evidence that cell phone use increases the risk of brain tumors and acoustic neuromas on the side of the head that you use the cell phone. And that this has a latency of about 10 years. In other words, studies that have been done where people haven't used cell phones for longer periods of time have in general not shown any relationship. But almost every study that's been done that has been able to find and study long-term users is finding this elevated incidence of brain cancer and acoustic neuromas, which is a benign tumor but a space-occupying tumor of the auditory nerve. Now, this has enormous implications. If these results hold up in future studies, we may be seeing an epidemic of brain cancer and acoustic neuroma. And that's particularly true because we know children are more vulnerable than adults to just about every exposure. And it's these little kids that are spending hours on the cell phone with nobody saying, wait a moment here, this is potentially a very dangerous thing to do, and most parents haven't a clue that they should not be allowing their children to talk on the cell phone so long. And you know, the solution is very simple. Use a landline. Landlines don't generate radio frequency fields. Now, some parents might argue kids spend too much time on the phone. That's a different issue. But you don't have to talk on a cell phone to communicate with your friends. And we have very strongly suggestive, but not yet definitive evidence that long-term use of cell phones close to your head constitutes an elevated risk for brain cancer. There are a number of reports of effects on other organ systems from radio frequency fields, but they haven't been studied nearly to the degree that the brain tumors have. There's some evidence for elevated leukemia, which is the disease that's particularly elevated with the power line frequency fields. Now, we know a lot more about the power line frequency fields, and I should say that those are less energetic than the radio frequency fields. And so superficially, if it's simply a matter of energy, and we don't really know whether that's true or not, one would expect that the power line frequency fields would not be as dangerous as the radio frequency fields. Now, for the power line frequency fields, there's strong evidence for an increase in Alzheimer's disease and Lou Gehrig's disease, amyotrophic lateral sclerosis. We don't know the mechanisms or the causes of these diseases. But when you have studies that show 4, 5, 6-fold increase in risk in people that have long-term exposure, I think one of the first studies was actually done here in California, where they looked at women that worked on sewing machines as an occupation. And they sat there sewing on an electric sewing machine for 8 hours a day and had very high incidence of Alzheimer's disease. So there are many other diseases of concern. And the problem is that we only know the tip of the iceberg because of the lack of study. Now, in animal systems and cellular systems, we know many biological effects. But a biological effect is not the same thing as a human health hazard. But we do know that these fields do alter a variety of cellular functions. We don't know enough about exactly what a great risk these are. What we do know is that we are all exposed. So any study of human health that's done, you have no unexposed population to compare to. We do know that for both power line fields and for radio frequency fields, there is strong evidence for adverse human health effects at field intensities that are common in our homes and our offices. So it isn't like many chemicals where it's only a few people that work in a particular industry that have an exposure and therefore you can see the disease. So the fact that the harm is being done at field intensities we all experience. I mean, I was told when I came in that right behind this sofa is the power cables to this floor, and that I'm sitting in a field of 10 milligauss. That's not safe. But, you know, in our homes, when my youngest son was little, I took my Gauss meter and measured the fields in his bedroom. His bed was on the side of the room that had the wiring, and it had about 10 milligauss, whereas the other side of the room was down to less than 1. You don't perceive these fields. So, and since we all move around in our environment every day, we don't know what our aggregate exposure is. The studies that have been done have almost without exception only been able to monitor one form of exposure. They monitor the home in which you live in relation to the power line in the street, but don't account to the exposure that one gets from appliances. They don't consider the school that the kid goes to or the occupational exposure that an adult has in relation to the exposures at home. They don't consider the exposures when one walks down the street or goes to the gym. Anywhere there is electricity, anywhere where you can receive a radio or television station or use your cell phone, you are being exposed to these fields. So the problem is that on the basis of the studies that have been done today, one might say, well, these may not be the most serious environmental hazards in our environment. But the reality is we have no idea how dangerous they are. I can say with confidence we know they're dangerous, and that I fear that 10, 20 years from now, we're going to see how dangerous they were. It's almost like cigarette smoking and cancer. You know, it's interesting, there's a recent book by Deborah Davis, a wonderful book, that documents that the Nazis had definitive evidence of the hazards of smoking. But in the US, the American Cancer Society, people in the Centers for Disease Control, most of them being smokers, a number of them having investments in cigarette companies, refused to accept the results that came from the Nazis, the excuse being these are the Nazis and they're bad guys. Of course they were bad guys. But as a result of that failure to recognize a very serious hazard, we had over 20 years when the American public was not warned of the dangers of smoking. And many, many people died as a result of that. I fear that we're in danger of suffering the same fate, especially with the radio frequency fields. Our national and international agencies have ludicrous standards, standards that are so much higher than those exposures that we know cause human health effects. Standards that are 100 times higher. They have no basis in reality or in scientific justification. And it's like the failure to give warnings on cigarette smoking. The standards should be changed, and this is not an easy thing, because if the standards are changed to those that we recommend in our bioinitiative report, then we will not be able to meet those standards. And I recognize that, because meeting those standards would require a drastic change in how we distribute electricity, how we manage our communication systems. And, you know, I'm not suggesting that everything be dropped at precipitously without careful thought. But the failure to have standards that are based on the science fails to give that caution flag. And I don't mean to say that this is an area where the evidence is rock solid and 100%. It's not. It's an area where there is strong, very strong suggestive evidence for harm. And that should be reflected in standards that acknowledge the evidence. And as a result of setting standards like that, provide motivation to industry to find ways to allow us to still use our cell phones, but without dangerous exposures. To have electricity in our homes and our offices, but without dangerous exposures. And without a goal, industry is not going to change things. The question of synergistic effects is a very important one. We do know that these fields, at least some of these fields, damage genes, damage DNA, induce genes. Well, many environmental agents do that. And what we don't know yet is what will happen if one is exposed to a chemical agent plus an electromagnetic field that both induce the same gene. Do they add? Do they subtract? Do they more than add, cause real synergy? And unfortunately, there's very little information. There are a few reports that suggest synergistic effects, but at this stage of the game, we can't say with any certainty that we have demonstrated synergy. We can certainly say that it's very likely that we'll find synergistic effects when we know a little more. The standards that we have presently are simply not justifiable. And no matter how difficult it is to set standards that can't be met in every circumstance immediately without enormous disruption to our quality of life. And we're not advocating that. But setting standards that inform people that caution is important, that is essential and should be done as quickly as possible. In this country, funding for research on electromagnetic fields is almost nil. There are many unanswered questions. Some people say, well, we don't know the mechanism whereby these fields cause cancer. And that's quite true. But the other point is we don't know the mechanism of anything that causes cancer, or hardly anything. Most cancers don't have an explained mechanism. We do know some general things. Cancers result from things that damage DNA. EMFs do that. Cancers result through non-genotoxic mechanisms where alteration occurs in various factors that regulate growth and cell death. EMFs do that. EMFs induce stress proteins. They have effects on the nervous system. We don't know enough, but we do know enough so that the failure to identify one specific mechanism should not be an excuse for not lowering standards. Other people say there's no good animal model. You don't get cancer in rats. Well, we don't really care about the rats. It's the people we care about. They're the ones for whom we have the evidence that the electromagnetic fields cause cancer. Until there's motivation to find design changes, it doesn't happen. But when our Power Lines report was issued in the late 70s, I stated on a number of interviews that it was unwise to use an electric blanket. Electric blanket doesn't generate huge magnetic field, but you have it close to your body, so if you sleep with an electric blanket, you get quite an exposure if you're under it for 8 hours at night. Well, the Sunbeam Corporation that made electric blankets threatened to sue me. And I wasn't too worried about it. As a matter of fact, it was the first time anybody threatened to sue me, and I was a little bit amused. They never actually sued me, but a year later, they came out with an electric blanket, which they advertised as very low electromagnetic fields. And it was a very simple solution. In the old-fashioned electric blanket, the wires were sort of evenly spaced, and they went back and forth. Well, magnetic fields are vector fields, and the most effective way of diminishing them is to put two wires very close together, carrying currents in the opposite direction. So all they did was weave the blankets with two wires close together, two wires close together, and the magnetic fields went way down. Now, I'm not the engineer that can tell you how a cell phone could be changed or a cell tower could be changed so as to reduce exposure. But there are people that would be able to figure that out if the standards were lowered and if the public demanded for the protection of their health that the exposures be reduced. The principles that I mentioned with regard to electric blankets also apply to electricity distribution in general. We know that buried power lines generate hardly any magnetic field. And it's not because there's some ground between you and the power line. It's because when you collapse those wires together, the wires carrying current in different directions balance each other and cancel out the magnetic field. Now, we know that deficiencies in household wiring are responsible for a lot of ground currents that are not matched, and they contribute to generation of magnetic fields. Sometimes the neighbor's wiring defects will result in currents that flow through the plumbing in your house. So, there are many things like that that can be done. The magnetic field is totally a function of the current that flows. So just simply reducing the amount of current will reduce the magnetic field. Now that's a problem with your hair dryer because hair dryers in general generate a lot of heat and that takes a lot of current. I'm not as familiar with the technical ways of reducing RF exposure, but I'm sure there are similar kinds of things that can be done, and there simply needs to be the motivation by the industry to find those mechanisms. I think the reason lies with the power of the industry and their ability to influence our federal government, to some degree our state governments. I mean, we have this outrageous Federal Communications Act passed by the U.S. Congress that prohibits communities from opposing the siting of a cell phone tower on the basis of health effects. I was part of an appeal to the U.S. Supreme Court very recently. Our appeal was denied. A mother in the Bronx was concerned because the FCC was approving a new higher frequency cell phone communication, and there was going to be a cell phone tower on the school that her daughters attended. And all that she was asking was that there be an environmental impact statement on the effects of that higher frequency. And the U.S. Supreme Court refused to order the FCC to do an environmental impact statement. Our elected representatives are too influenced by the funds that come to them from industry, and we all suffer as a result of that. In a short review that we published soon after our study concluded, I think 1988, we calculated that if the same situation that existed in Denver on the basis of the original Wertheimer study and the replication that was done there by Dr. Savitz, if that applied to the rest of the U.S., then 10 to 15% of all cases of childhood leukemia might be attributed to the power line in the street. And then we further guessed that since children are exposed to many other sources of electromagnetic fields, the appliances particularly, exposures at school and so forth, that must be at least as great. So we calculated that somewhere between 15 and 30% of all cases of childhood leukemia could logically be attributed to magnetic field exposure. This is ignoring the RF, which we knew much less about in those days. So yes, I've been advocating for realistic standards based on health effects. The reason we don't have those standards is the physicists say these fields have such low energy they can't possibly have biological effects. But they do. And we have the evidence of harmful effects in humans and especially in children. Wi-Fi in schools is insane. You know, of course, one wants to do everything we can to promote children learning. And, but, you know, we've got to balance the risk against the benefit. And we've got to understand that you can have access to the internet without having Wi-Fi. I think no country has implemented standards as low as those that we have suggested. But there's at least more discussion, there's more research. It's true in Europe, it's true in Australia, it's true in Japan. But there's just almost nothing in the US today. The profession of public health is the prevention of disease, not the treatment of people that are already sick. And, you know, public health focuses on safe sex, on stopping smoking. But this is an issue where we have this rapid expansion and exposure, especially of children. I do a lot of my research is focused on children. And we're allowing this to happen. We have not learned from the lessons of the past that we should be protecting our children. If we protect our children, we protect ourselves. And you have a generation of kids growing up on the cell phone with no knowledge or thought and no understanding on the part of their parents that this may significantly increase their risk of serious diseases in the future. And that must not be allowed to happen.